on bed sila lagi, what happens is that this will trigger your body to destroy calcium in the bones, and it will start depositing back into the blood. So the problem here would be osteoporosis. That's why we give them calcium supplements. Antispasmodics may also be given for spasticity of muscles brought about by the paralysis. Examples of these medications are dantrolene, sodium, or baclofen. We also have analgesics for pain, either opioid or non-opioid medications, or it can also be in the form of NSAIDs. Antidepressants, if there is an effect on the mood of the patient, the behavior of the patient. Anticoagulants to prevent any clot formation brought about by immobility. This could lead to immobility, again, could lead to formation of blood clots. Stool softeners, this is for constipation and for vasodilators as well, are given to these patients to promote circulation. Nursing management, usually, we will focus on as to assessment and monitoring vital signs, neurologic status, signs of thrombophlebitis. So you have to check baka merong signs of thrombophlebitis or formation of thrombus, especially in the back of the knee. Spinal shock also, autonomic dysreflection such as hypertension, bradycardia, flushed face, etc. Oxygen saturation levels should also be monitored. Bladder distension should also be monitored. If there is bladder distension and hindi makaihi ang pasyente, expect that you will be doing intermittent catheterization. Indications of altered body image or self-concept. This is where your antidepressants may come in. Nursing activities, you will expect maintaining patent airway. So this is only a summary. We will discuss the specific interventions later. Maintaining mechanical ventilation when prescribed. Passive exercises or ROM. Encourage deep breathing exercises. These are again important to prevent immobility, prevent pressure ulcers, prevent contractures. What else? Prevent pneumonia. Pneumonia that is, there is a specific type of pneumonia that can result from immobility. You call that your stasis pneumonia. Stasis pneumonia. What else? Encourage active exercises if the patient is able to. Maintain skin integrity to avoid pressure ulcers. Assist with turning as needed. Maintain adequate fluid intake. Teach self-catheterization, especially as discharge instruction for these patients. Institute bowel retraining as needed. So, dapat meron kayong fixed routine for bowel and bladder movement. Teach regarding sexual function or dysfunction if they have problems with arousal, they have problems with increasing libido, etc. Emergency management. If there is already or during the initial stages of the injury, very important to take note of your EBC, airway, breathing, and circulation of the patient. So you have to check the breathing, the airway of the patient, the breathing of the patient, making sure that you give oxygen or also prepare ET or endotracheal intubation. As to the airway, again, jaw thrust maneuver to open the airway, no head tilt or chin lift, no maneuver to flex or extend neck. Okay, so these are examples. Ventilating the patient with 100% oxygen. Breathing naman, keep in mind that the diaphragm is innervated by C3, C4, and C5. So, ibig sabihin, any lesions or any problems with C3, C4, C5, expect that the patient's diaphragm will not be able to function well. So, in this case, this will entail the need for mechanical ventilation. So, outside source that will now open the airways of the patient. Intercostal muscles are also paralyzed if the affectation of the spinal cord involves your thoracic 1, cervical 2 to C8. So in this case, expect that mahihirapan or there is labored breathing in patients affected or patients whose spinal cord or this T1, C2 to C8 na spinal cord are affected. Abdominal muscles are paralyzed when the lesion is located above T11 to T1. So in this case, kung alam mong any of the following ang affected na areas ng spinal cord, immediately try to check yung airway, breathing, prepare oxygen, and possible intubation of the patient. Immobilization, a backboard with head and neck maintained in a neutral position is expected from you. What else? No part of the body should be twisted or not aligned with the rest of the body. Immediate transfer to tertiary facility. So, emergency management to ha. What else? For pulmonary complications, again, ang problema kasi with spinal cord injury, it's usually pulmonary complication. So, siya yung pinaka leading cause of death after spinal cord injury because of paralysis of the diaphragm as well as the accessory muscles. So, very important to instill in this case would be chest physiotherapy, postural drainage. So, you're going to position the patient every 2 hours so that you will allow drainage of secretions from the lungs and out to the mouth of the patient. Suctioning may also be needed every 2 to 4 hours. So we have here chest physiotherapy. We have here postural drainage. We also have here suctioning every 2 to 4 hours. What else? Incentive spirometer. Incentive spirometer is used to determine spirometer. Determine the capability of your patient to inhale and exhale. So this will also assess yung ability of the muscles to help in breathing of the patient. This is also a way to improve yung mismong breathing capacity ng pasyente natin. ABGs are also monitored for oxygen saturation, chest x-ray, possible intubation, and mechanical ventilation. Let us now continue with specific nursing interventions. First one would be to promote adequate breathing and airway clearance. How can we do this? We will do this by first recognizing signs of respiratory failure. So that is the RF here. Our mnemonic for this one would be SOVA. In S, this would refer to monitoring the oxygen saturation of our patient. This is through checking of the ABGs as well as the pulse oximetry of your patient. What else for letter O? That is to observe the patient for signs of respiratory failure. So you're going to monitor breathing patterns of the patient, the rate of the breathing of our patient. We also have to look into any signs of cyanosis, for example, that would indicate lack of oxygen or hypoxia. We also have V. This would stand for measuring the vital capacity of our patient. A would again refer to arterial blood gases. Next intervention under promotion of breathing and airway clearance would be for nursing interventions addressing atelectasis or lung collapse and secretions that will accumulate in the lungs that may lead to pneumonia. Pneumonia is actually one of the leading causes of death in patients after spinal cord injury. So we have here things we can do. Letter S, that is to suction our patients every 2 to 4 hours or when needed. Be warned, however, that in the case of suctioning, we have to prevent or we have to avoid stimulating the vagus nerve because the stimulation of the vagus nerve can lead to bradycardia. That is bradycardia. As well as cardiac arrest. So we're trying to avoid stimulation of the vagus nerve if there is already excessive suctioning. What else we also have here? C would stand for chest physiotherapy with postural drainage. And we also have P that would now be, ayan, yung postural draining natin. Proper positioning of our patients. Next would be to assist our patients in improving their inspiratory muscles. This would be done by assisting our patients in breathing exercises. What else? We have another C here, coughing exercises. So these are the things we can implement for our patients with SCI. Now let's continue with addressing our patients' problem with mobility and proper body alignment. We can do this by first, our mnemonic for this one is PRST. P would be to position our patient. Maintaining, this is done by maintaining proper body alignment. What else? Placing the patient in dorsal or supine position. What can we do? What else can we do? We have here elevating the head of our patient slowly. What is the purpose of elevating the head of our patient slowly? This is to prevent orthostatic hypotension or sudden decrease of blood pressure due to positional changes. What else in R? It's your ROM or range of motion. This could either be passive or in the case of the unaffected side of our patient, we have active. In passive range of motion exercises, usually done within 48 to 72 hours after injury. So that's around 2 to 3 days after the injury. We try to initiate already passive ROM. This is to avoid any complications such as contractures and atrophy of the muscles. This is again because our patients are unable to move. They have problems of immobility. Another would be, what else? As to duration or how many times will you be doing the ROM exercises? Full range of motion exercises should be done at least every 4 to 5 hours. That is 4 to 5 hours. To be initiated immediately 2 to 3 days after injury. So in this case, usually we try to do daily ROM exercises in the toes of our patients, metatarsals of our patients, the ankles, the knees and hips of our patients. And we also have here the purpose of our ROM is to prevent emboli in the lungs of our patient. Another would be to put splints and trochanter rolls. So this is more of an orthopedic intervention. So this is again used to avoid foot drop. What else? We also have here turning our patient or lug rolling. That is every 2 hours, 1 hour pag elderly ang patient. We have to monitor also hypotension in patients with lesions in the mid-thoracic level of the spinal cord. Kasi nga affected yung possibility of venous pooling of blood in the lower extremities. Baka mahihirapan ng tumaas or umakyat yung blood to the heart. What else? It's also necessary that we apply splints to our patient and making sure that the patient's hips are externally rotated. Externally rotated ang hip joint ng pasyente natin, and then we're going to reapply the splints and trochanter rolls every 2 hours. So these are our interventions for mobility and proper body alignment. For adaptation to sensory and perceptual alterations naman, what do we mean by, our mnemonic for this one is SHE. S would stand for stimulate. We have to stimulate the area above the level of injury to our patients. This is done by allowing the patient to touch, giving aroma so that they can smell, give them flavorful food. We have to converse with our patients, allow music to be played in the patient's room. This is to stimulate still the central nervous system of our patient para hindi naman mapabayaan. Hearing aids may also be applicable. Emotional support and coping is also important. It is very necessary that we also provide instructions for significant others as well as emotional support or give instructions for significant others and friends of the patient so that they can also assist and support the patient. For maintaining skin integrity, this is a complication of immobility. We mentioned that this can lead to pressure ulcer formation. So it's important that we do position changes or lug rolling every 2 hours, inspecting the skin for any signs of damage or injury to the skin. What else? Assess for any redness or breaks in the skin over pressure areas. Pressure joints are usually the back of the patient, especially on the hip area, buttocks area. Yun yung pressure point na isa. We also have here dun sa may sole area ng pasyente, the heel area of the patient, the back of the heel. So these are pressure areas. Take note of any signs of redness or breakage. We also have to wash the skin of our patients with mild soap and make sure that they are dried enough. Yeah, what else? Maintaining urinary elimination. So you would expect that you will be doing intermittent catheterization. So in this case, usually you're only going to insert a catheter in the patient if ever nagkakaroon ng urinary retention and you're going to remove it again. However, there are some instances that the doctor will just initiate indwelling catheter. Ibig sabihin, you'll just leave the urinary catheter inside the patient para diretso na yung ihi niya. What else involve the significant others? What do we mean by this one? Instruct the significant other of the patient so that they may know what to do when they're going to catheterize the patient on their own, especially during discharge already. Monitoring fluid intake of our patients is also important. Voiding pattern and the amount of urine that has been voided by the patient after catheterization should also be recorded. What else? Improving the bowel function. This is done by giving a high calorie, high protein, and high fiber diet for our patients. Food amount may be gradually increased after bowel sound will resume. Stool softeners for constipation. Bowel program or maintaining a bowel program for our patients is also important para matrain yung digestive system as well as the bowel training for our patients. Provide comfort measures and monitor and manage complications such as thrombophlebitis, orthostatic hypotension, spinal shock, autonomic dysreflexia. We already mentioned the specific interventions for these complications. Assist the patient with surgical reduction and stabilization of cervical vertebral column. So this would refer to patients having cervical fractures or cervical problems already. Yung affectation ng spinal cord ay dun sa may cervical area. There are also orthopedic interventions for these patients, but we will reserve that for our discussion on fractures and orthopedic nursing. So that is for the different nursing interventions for SCI.